Good evening, everyone, and welcome to our community meeting about the City of Alameda 5-year Homelessness Strategic Plan. We're so happy to have all of you with us this evening. We're going to start with just a couple of Zoom tips and housekeeping items before we get into the content and agenda for this evening. We are recording this evening, and we will be using Zoom technology to just keep in touch with all of you. We encourage chat and questions that will be made accessible to those of us who are in the presenter panelist level. If you have any tech challenges this evening, please feel free to put any questions or issues in the chat. Or you can email us at cityofalameda@homebaseccc.org, and we'll try to be responsive to any issues coming up for you. Tonight, we're going to be using the chat and poll features to engage with folks. So you may see some pop-up screens on your device. Those are polls for you to answer. And you are also welcome to use the chat to respond to any questions that we're asking, which we actively encourage, as well as to ask questions that you may have tonight. Chat messages are only going to go to the hosts of the meeting, not to the community at large. And we can make closed captions available for anybody who has that need as well. So we're going to go ahead and do some introductions of our presenters for tonight. My name is Amanda Wehrman, and I'm a director with Homebase. Our organization is a nonprofit based in San Francisco that is supporting the city of Alameda in the 5-year strategic planning process for addressing homelessness in the community. So we're very happy to be supporting. I'm going to pass things over to my colleagues, Aram and Miguel, to introduce themselves, and then we have some representatives from the city as well.
Hi all, Aram Houslip with Homebase, a senior staff attorney. Glad to be here, and I'll be helping to present some key terms and best practices. Miguel?
Hello everyone, my name is Miguel Becerra. I'm a senior policy analyst with Homebase, and happy to join you. Thank you for joining us. Is it over to Amanda?
Miguel. My name is Amanda Gerke. I'm with the Community Development Department at the City of Alameda, and I'm the project manager on the city's side for this. And I just want to put a little plug in for our mailing list for this project. If you are not already on it and you would like to track the progress of the plan as it moves along, I think Aram put the sign up for that in the chat. So please do sign up, and I will pass it to Lois.
Hi, I'm Lois Butler, and I'm also with the Community Development Department, and I will be sitting in answering questions as needed regarding the homeless program.
Great, thanks everyone. We're also happy to be with you tonight. Thank you for spending your evening with us and engaging in this important topic. So to give everybody a chance to find that chat feature, we wanted to start with a question that takes us out a few years and just consider looking ahead. What's one word you hope will describe our community's response to homelessness in 5 years? So this is a bit of a visioning exercise. We're looking for some ideas from folks about what you're hoping to see in the future around homelessness. I see some folks are already putting ideas into the chat. Housing, compassionate, everyone under one roof or a roof, functional zero. These are good, keep them coming. Compassionate. Inclusion, realistic. And just so folks know, like I was saying, this is only going to the panelists tonight, but we're reading off responses for folks. So thanks for your patience with that. A couple of folks said effective. Exactly. So appreciate all of these responses, and it really helps to take the pulse and know why we're all coming together around this strategic planning process, and the hope that we all share for the future and how the community can come together. I see one more coordinated. Thank you. All right, so moving ahead to our agenda for the evening, we're going to go until about 8 o'clock, and we're hoping to cover a few different things together. First is the key terms and best practices. We wanted to give everybody a shared foundation in the homeless system of care, some of the normal terms and phrases that we use in talking about the programs and services offered, as well as some of the common approaches that we take that are considered best practices in the field. We'll then spend a little bit of time digging into some data that we have to understand who's experiencing homelessness in the city of Alameda and how we know that. So we'll give everybody a shared base of knowledge from a data-driven perspective. We'll then give a brief update on the strategic planning process that the community's been engaging in. And then we'll spend most of our time after that on the emerging goals of the strategic plan. We know that there are goals and strategies that can support us in moving forward towards that vision that you all shared with us tonight. And so we'll unpack that, including some ideas around further community engagement that we're really hoping to get your feedback on. So one more question for you before we shift into the key terms. You can enter into the chat box, what brings you to today's meeting and what do you hope to learn? So we really want to make sure that we tailor the things that we're covering tonight to what brought you here. So if you have some questions or things you're hoping to hear tonight, let us know and we'll make sure to kind of tailor our presentation to address those questions. All right, and as folks put some of those ideas into the chat, I'll hand things over to my colleague Aram, who's going to orient us around key terms and best practices.
Thank you, Amanda. More coming in the chat. Mayor Ashcraft, thank you. Compassion and desire to be part of the solution, I'm seeing. Urban planning background, nonprofit supporter says, would like to see the unhoused population be zero in Alameda. Folks really wanting to hope to understand what can be the most effective interventions, and I hope we're going to help address those things as well, including how the public can participate. And I see a bunch of people talking about volunteering and being part of different faith groups. So I'm hoping we will actually touch on many of those things. So right on point. With that said, before we get into covering some data and getting into the emerging strategies that have come about as we've been doing this process, and we'll talk a little more about who we've engaged with so far. But what I'd like to do is spend a couple minutes just speaking about who we are trying to serve with this plan and a little bit about the front door and some different housing options. So folks know we're working on a 5-year strategic plan to both prevent homelessness and reduce and end homelessness. So some of these terms folks might be familiar with. At risk of homelessness, I imagine you can guess to some extent, but really what we're talking about here is folks who are likely facing eviction due to back rent or past bills with utilities, and we'll talk later about how that's representative of a lot of people in Alameda. And so at risk means almost becoming homeless. So if we could do eviction prevention or legal assistance, that would be something that could affect keeping people from entering homelessness. Homeless and chronically homeless, these have very technical definitions from the Department of Housing and Urban Development and sometimes locally. But in a nutshell, when we're talking about homeless folks, we are talking about people who are generally literally homeless. So that means folks on the street, living in a car, living in somewhere that's not really habitable, an abandoned building, or staying in a shelter already and looking for housing. Chronically homeless is basically folks who have been homeless generally for more than a year, but also have a disabling condition. And sometimes some of these folks are the more visible homeless you see and need different interventions than those that are necessarily at risk. And finally, there is generally a carve out for those who are fleeing violence. So while they may be housed technically, they are in great danger, and this can include human trafficking, intimate partner violence, domestic violence, gang violence, things like that. So the system wants to allow for people that are kind of constructively homeless. And as I'm going along, if folks have questions about these terms, put them in the chat. If I miss, I think one of my colleagues will grab, but I'm trying to watch that as well. So next, I want to talk a little bit about the front door. So, and prevention and diversion hopefully are happening almost before the front door. So again, as you can imagine, we were talking about the at-risk population, and that's where prevention really is an essential piece of the puzzle. And that can be used again to support people with legal assistance, pay back rent, but really keep people housed. Because we know it's obviously a lot more expensive and a lot more traumatizing to folks once they've ended up on the street. Diversion is a similar concept, but usually it's when someone has just become homeless and we're trying to divert them from having to enter the shelter system. And diversion can include things that will help them immediately identify another housing option. So it could be a quick moving grant. It could be paying for groceries so they could stay with their aunt, but something that would to enable people to stay housed. And finally, I want to emphasize what is known kind of technically as the coordinated entry system, and what the federal government and state governments now in California as well are really starting to do is understand that homelessness is a regional issue. And while some people may be in Alameda one night or Oakland another night, generally people are trying to get back from where they live, but may need to be in different places while they're trying to get back on their feet. So what coordinated entry does is it provides a front door where everyone's getting the same assessment. Sometimes it's multiple locations, sometimes it's one, we've done through phone hotlines, but really it's an entry point to make sure that we see everyone coming through the door, that people don't slip through the cracks as much, and that we're able to often try to solve homelessness for those who are most vulnerable or have the most things going on. So coordinated entry is held at the county level, but Alameda has a role and has locations locally as well that feed into that system. I'm not going to go over all the terms on the slide here, but I wanted to give people an idea as we start talking about temporary and permanent housing, what that really looks like. So you may be familiar with some of these words. I'll just highlight a couple on the temporary side. Emergency shelter and navigation centers, and even community cabins, or that concept, is really the temporary spot for someone to hopefully get some assistance for basic needs, and then hopefully also making sure that there's a long-term solution for housing. Permanent housing options, certainly we know people can rent market rate places or own homes, but in the homeless context, we're often talking about permanent supportive housing, or PSH, and rapid rehousing, or RH, sometimes public housing authority as well, and people may have heard of the Section 8. But rapid rehousing essentially is a subsidy program for rental assistance to help people maintain a unit to get back on their feet, and is up to 24 months. Where permanent supportive housing may be for that person who's chronically homeless, and they're going to need a longer period of time, especially because they're generally dealing with disabling conditions. And we'll get into some stats around that as well, so people have a better sense of who we're talking about. The last main thing I want to talk about before we get into some data is the concept of housing first. Many people may have heard of this, and so I want to just clarify. I was a case manager, frontline worker for many years, like 10, 15 years ago. And at that time, we were generally, a lot of us were still working in what we kind of term housing readiness, or kind of treatment models. And essentially, what we were thinking was that we need to assess people to make sure they're ready to be housed. We don't just want to put someone in housing. We're worried what's going to happen at that point. And so what we would essentially be telling people is what's on the left side of the screen. Right now, you have no place to live, and we need you to get ready. And what that plays out is we need you to get shelter and not lose your bed, even if like there's a set curfew and you have a late job and you can't get back. Get sober and kind of don't make any mistakes. Get therapy and stay on it, don't miss a session, or stay medicated. Get a job and often make enough to pay half your rent. And finally, learn how to live independently when really, if you think about it, many of us lived with our families. Maybe we're lucky enough to go to college, stayed with roommates, and then moved on and lived with partners. So individual housing is actually kind of not the norm. So we were kind of setting all these folks up thinking that we're getting them ready to get housing. But what has actually happened, and we realized over the last kind of 20 to 30 years, that actually doing the opposite is more impactful. So when people have no place to live, what Housing First is saying, we need to get you inside quickly, because that's the only way you're going to feel stable enough to be able to kind of pick yourself up. When we talk to folks with lived experience, it just seems like most people feel like they're getting more and more buried the longer they stay on the street, and the harder it is to dig themselves out. They really try at first, but it just gets harder and harder and harder. So the goals in Housing First are going to always be about removing barriers to housing or accessing housing. So avoiding issues that don't directly relate to housing. Even if a case manager thinks it's something someone needs to work on, we really want to make sure they're housed. And you'll get support if you want to. So it really promotes supportive services that are voluntary and really trying to keep people in housing at all costs. And of course, if behavior or safety issues come up, that would be different. So the idea is let's get people housed, and then they can be ready to stay housed. I think there may be still some critics of that too, and people that are skeptical, and I want to talk a little bit about that piece. But what this Housing First does is it truly serves people with complex needs. It serves people that are used to getting turned away, or maybe to have something on their background. So these are the same people then continue to stay on the street, and maybe they stop wanting to proactively get housed. And so that's something that Housing First is going to address, is the people that are probably that you're seeing on the street. If they've been there for years, they're often falling into a category where they could be served best by Housing First. So I could go on and on with lots of studies and reports, but I'm only going to give you a few just to help emphasize my point. But why Housing First? The reason is because it's based in evidence, and it's based in studies that have been done, and it has been done against the old model of the readiness and treatment. And what we've found over and over again is in almost every kind of situation, Housing First models have better outcomes. So the first one, and the most essential one, is ending homelessness and creating housing stability. There's been a bunch of studies. I want to mention one in New York. They followed folks for 5 years, 242 people, and 88% of tenants in Housing First scattered site units. So those are basically out in the regular market, just putting people in regular apartments. 88% of those tenants remained housed through those 5 years, versus 47% who were in more typical treatment models where you had to be ready, or you were required to do services, or required to attend drug classes. The folks that were in the Housing First, the risk of interruptions was 4 times less than, so I should have said it the other way. Folks who were in usual treatment were 4 times greater to experience housing interruptions and housing instability. The other thing I want to talk about is the improvement of health and mental health. One of the things that people get concerned about when you say we're going to do supportive voluntary services, well, what about people using drugs or alcohol or other mental health issues? And what we've actually found is providing folks with more autonomy and helping them choose their plan actually has shown improved health, improved mental health, and drug and alcohol basically stayed flat. So it's the only area where it wasn't better, but it wasn't worse. And actually, in many cases, people stayed more stably housed in those situations. In LA, they looked at 809 individuals in a Housing First program, showed significant improvement in mental health functioning after 1 year of being housed, and they stopped using medical and mental health services substantially. And the year after entering this type of housing in LA, inpatient hospital stays dropped by an average of 4 days, and clients made on an average 1.5 less ER visits. So the strain on the emergency services gets relieved. Reduces contact with the criminal justice system, I think, is also a key point. In North Carolina, they looked at folks who had been arrested or jailed in the 2 years prior to moving into a Housing First permanent housing program. And these folks experienced an 82% reduction in arrests and 1,000 fewer nights in jail. It's down 89% for the people that used to be in and out of jail using these Housing First problems. And lastly, saves money, which I think we can all support that piece. It really, as we've been talking about, it really saves money on reduced shelter usage, hospitalization, detox, medical respite, emergency department visits. In Massachusetts, they found that it basically saved $12,000 per person a year by using House First programming, because they could relate it to these different things. So I see also we have put in the chat a link. It's a great resource to better understand the evidence on housing first. And so I really invite people to take a look at that if they want to learn more. I don't see any particular questions yet. So what I want to do is, now that you've kind of been given a rundown of some of the things that may be worth you learning more about, or maybe was surprising you want to dig more deeply, we want to know if there's anything else that you might want to. So in the chat, feel free to type in what other topics around homelessness would be helpful. Is it more about the participants in these programs? Is it about different interventions that you've heard about, or different strategies? Are there things that you've heard, well, we know this doesn't work, I want to hear what does, or those types of things? So feel free to put any of those suggestions into the chat. And I'll just pause for a moment there before I turn it over to my colleague. Certainly, if stuff comes up, please let us know. Seeing a good comment come in, programs that are active at Alameda and working on this, in what ways? And another question, what can and should we do first, and how? Folks are interested in information about the budget to accomplish these goals. All really good questions. More coming in. Let me just see. So we're gonna save all the chats and make sure to keep this in mind, because we're also going to ask you near the close of this more ways that you all think you want to be involved, what kind of settings they would be, what you would want to learn, what you would want to learn about. Folks are asking, is there one place that you can find definitive resources to? The city of Alameda has a great landing page for how you can help your neighbors, essentially your unhoused neighbors. And so there's a whole bunch of things that listed. If folks want to learn, I can try and find the link for that too. But if folks want to learn more about what's being offered in the city, there's some great stuff there. And there's a homeless hotline listing too. So if you're seeing folks you think need help, folks are asking about funding. So I think the city is looking at what they can do. And then obviously what we try to do is leverage a ton of funding that is now coming in through the federal government, and California is really making a large investment. So part of the goal over the next couple of months is to really think about how we can leverage these funding sources, because sometimes they need to be matched. And so, like, how can we get the biggest bang for our buck? Lots of good other questions, and we can try and come back to some of these as well, but I do want to make sure we get to the other pieces. So with that, I am going to pass it over to my colleague, Miguel, to talk a little bit about who is homeless in Alameda and how do we know? And hopefully that will start to answer some of the questions that just came in. So thanks, Miguel.
Yeah, thank you, Aram. And thank you everyone for participating and for all your thoughtful questions and comments. So I'm going to talk a bit about what we found through the data around the homeless population in the city of Alameda, and I'll focus on some characteristics and risk factors and how this might have changed over time. And I'm going to be showing a couple of graphs, so I apologize in advance for, I think most people are joining us like through a computer, and most people can see the slides, but if you're calling from your phone, cannot see and you cannot see our slides, the slides are going to be posted online later. So I know they're also going to be shared with people that have registered for this community meeting. So we can go to the next slide. Thank you. So before I present some of the findings, I want to provide some very brief background information about the data sources that we analyze. So, there are a variety of data sources that we looked at, which are listed here. Each have their own advantages and limitations. And I'm not going to be talking about all of them right now due to the sake of time, but Just going to focus on two of them for now, since they're two of the main data sources in the homeless system. And those are the PIT count, or point in time count, and the HMIS data. And I think some of you in this room might be familiar with it already, but the point in time count is just like the name indicates, it's a count of people experiencing homelessness at one point in time. So one of the limitations is that, it doesn't really show us the total number of people who are homeless over the course of a year. So it's just a snapshot at that moment. And they're normally done every 2 years, and they're usually done on odd years. But this year, due to the impact of COVID, most communities nationwide, including Alameda County, for obvious reasons, opted not to do it. So therefore, when we're going to be presenting PIT data or point in time count data here, it's going to be the most recent one is going to be from 2019. And then the other data set that we looked at is the Homeless Management Information Systems, or HMIS. And this is the data set for people that access homeless services. And it's also administered at the county level, but the data set available for this study was for people with ties to the city of Alameda, which in this case meant people that were either born in the city, went to high school in the city, or were last housed in the city. And this data set that we looked at here goes from 1996 to 2021. So I'm going to be showing now a couple of different graphs, and I know people may have questions, so we're going to leave some time in the end for questions or comments, but feel free to, just let us know any questions or thoughts you have in the chat. Thank you. Okay, so this first graph is showing the number of unhoused people in the city of Alameda in 2017 and 2019. So again, keep in mind that this is just from the PIT count, so it's just a snapshot on that day, not the total number of homeless people over the course of the year. So in 2017, we found that there were a total of 204 people experiencing homelessness, out of which 110 were in shelter. And in 2019, there were a total of 231, out of which 132 were in shelter, so that orange part of the bar. So what we're seeing is that the total number increased from 204 to 231, which was a 13% increase. There was a little bit big increase for the shelter population, which increased by 20%. But something I want to point out is that these are actual similar trends with what as we're seeing in the rest of the county, I would say the rest of the state, and actually in some other regions it actually increased, especially in shelter population increased by more. Thank you. We can go to the next slide. So one thing, we looked at the 2019 data by city in the county of Alameda. So this data indicated that in the city of Alameda had a lower ratio of people who were in shelter compared to the homeless population in other cities in Alameda County. So again, this graph is showing the total number of people experiencing homelessness who were sheltered and unsheltered by city in 2019. So this is just showing the raw numbers, but the overall percentage of the homeless people who were in shelter in Alameda County was 79% in 2019. And when we compare it to just the city of Alameda, we find that actually only 57% of people who were homeless were in shelter in the city of Alameda, which, I think it's a more manageable number than in other cities. So yeah, I think this was an interesting finding. Again, the city of Alameda was the city with the lowest ratio of unsheltered people in the county. So we also looked at the number of people experiencing homelessness by race and comparing to the overall numbers in the general population for the city of Alameda. So just something I want to just point out. So even though the PIT count, as mentioned earlier, is administered at the county level, so the original PIT count doesn't really have data for the city of Alameda for rate in terms of race. But there are stats that are based on a system model that the county did for the city of Alameda. So this is what we're presenting here. So according to the estimates from this system modeling, the biggest group experiencing homelessness is the Black or African American population. As there are 41% of the homeless population of the city, so of the homeless population of the city. And this finding is particularly concerning when comparing the numbers to the percentage of the general population of the city, which was 7%. And this number is based on ACS, American Community Survey data, which is estimates from the census. And then the American Indian or Alaska Native population also showed a similar trend, as there were 4% of the homeless population of the city, but only 0.5% of the general population. And again, the orange bars are the homeless population, the blue bars are the general population. But something we do want to mention is that, we see this overrepresentation across the Bay Area, across California, and we would probably say like across many other parts of the country. So this is not an issue that's unique to the city of Alameda. Now, there are obviously like factors of systemic racism which relate to poverty and have an effect on the inflow of people entering the homeless system. Thank you. So we found that just as some groups are like some groups in terms of race are overrepresented in the homeless system, veterans are also overrepresented in the system. This may not come to surprise to many people in the call, but we looked at data for people that access services, access homeless services in the city that had ties to the city of Alameda, and we compared them to the overall to the general population of the city of Alameda. So the red bar here is showing the percentage of people who are homeless and indicated that they were veterans when they access services. This data is from 2015 to 2019. We compare them to the same period of time for the city of Alameda, again, based on American Community Survey data, which is based on census data. And we found out only 4% of them were veterans. I think this may come to no surprise to people on the call, but just, yeah, this is, I think, another interesting finding. We also look, again, the PIT count, which is a point in time count for people experiencing homelessness. We also found a little bit similar trends for the county overall, and it was 9% of people experiencing homelessness were veterans. Can go to the next slide.
Miguel, it's Aaron. Before we move on, there was a question about the Latinx population, and if you just wanted to make a note on that.
Okay. Thank you for mentioning that. Yes. So the way the PIT data for the county, point in time data for the county of Alameda, did show that the Latinx population was about 15% for the county. This is actually, yeah, it's interesting you pointed out because actually, based on the system model, we didn't actually receive this number just for the city of Alameda. So actually, we also looked at the HMIS data, which is the data for people that access services in the in the city, and we found that 15% of them were identified as Latino or Latinx or Hispanic. And it was a little bit similar trend to the general population of Alameda, which was 13%. So yeah, unfortunately, we couldn't really. It's not the same population we're comparing. So in this data set, we couldn't really we didn't include it because it would be like a different population here. But thanks for the question. Yeah, and it's an issue like with the way that data is reported, and yeah, so it's Latinx is not considered a race, but it's considered an ethnicity. And I see another question. Sorry. Do we want to probably want to save that for the end? I'm guessing because we're gonna. Yeah, we can.
Yeah,
save
we'll take a pause. Yeah.
Mm-hmm. Okay. Thank you. Yeah, and thanks for the questions. So this graph is also based on the data for those that access services. So what we did here is we looked at the median age of people entering the system over time, and we found that the median age has continued to increase over time. So as this graph shows, in 2008, the median age of people who were accessing homeless services was approximately 40 years old. However, in 2020, the year of highest impact of COVID-19, the median age was 52. So again, this is data for age of people when they enter the system or when they access services. So it's not the case that people that continue to receive services from the same provider are driving the age up. We took that into consideration. So it's just for people that their age when they access services. And as this bar show, it kind of goes up and down. So it's not completely linear, but the trend line there shows that the trend is it's continuing to go up. So the homeless population is aging. Again, the starting point was 40, the ending point was 52. But another thing I want to point out is that this trend is also seen across the region, across the state. It's not unique to the city of Alameda. So it's something that's happening across many regions. Mm-hmm. Yeah. Okay. So we also looked at data to assess how many people were experiencing different conditions or situations when they access services. Uh, and I don't know if people can still see the graph or no.
Aram, I think we lost the screen share.
Okay, so while we get that back, just want to point out a couple of things. Thank you. So you found that while 66% of people reported having a disabled condition at intake, only about one-fourth of them reporting having a substance abuse issue, which I think demystifies a common belief that most people who experiencing homelessness had substance abuse issues that led them to homelessness. So really, like what we're seeing is that data doesn't really support this belief. What we did find is actually most people were experiencing a disabling condition. And, when we talk about disabling conditions, this includes things like cancer, HIV, or physical disabilities. All of these are conditions that prevent regular functions needed to secure income or keep housing. And another finding that I think is worth pointing out is like 44% of people, almost half of people were experiencing mental health condition or disorder when they entered the program. Yeah, so we can go to the next one. So far, all of the data we've presented has been on people who were experiencing homelessness, but we also looked at those who were not homeless, but who may be at risk, or it's important to consider all the risk factors that may eventually lead to homelessness. So one of the ways we did this was by looking at data on housing problems, needs, and cost burden for the city of Alameda. And this graph is from a data source called a Comprehensive Housing Affordability Strategy, or CHAS. So we analyzed this data for the city of Alameda. It's probably not surprising to hear that people who rent are generally at a higher risk of losing their housing than people who own their homes. And we think, the data confirms. So there's research that shows that there's a link between housing burden and homelessness, and communities where residents tend to spend more than 32% of their income on rent can expect to see an increase in homelessness. And I'm sure we all know this is something that happens across many regions of the Bay Area, many cities in the Bay Area. So the data does show that housing burden affects renters at greater rates than homeowners. And based on this data, if you look at the red and yellow bars there, or orange bars, sorry, we're seeing the people that spend 30% or more of their income on rent. And in the case of renters, we're seeing that that's 41%. I think that's a very important finding. 41% of renters are spending 30% or more of their income on rent, whereas 28% of homeowners are spending that same amount. Again, this might place this group at a greater risk of losing their homes and eventually entering the system. And we can go to the next slide. Thank you. So finally, we also looked at the impact of housing problems on residents of the city of Alameda. I think it's not a surprise to hear that housing problems cause instability, which may lead to someone eventually losing their home down the road. So the data also indicates that renters tend to have housing problems at higher rates than homeowners. So what we're seeing here, those red bars, and so in the city of Alameda, 46% of renters have at least one housing problem in comparison to 28% of homeowners. And I know you may be wondering right now, like what I mean by housing problems. So the way this data sort the CHAS data defines housing problems, they identify four housing problems. One is lacking complete kitchen facilities. Another one is lacking complete plumbing facilities. Another one is household that's overcrowded, and household that are cost burden, like we just mentioned previously, like spending 30% or more of their income on rent. So again, we found that 46% of renters were experiencing at least one of these housing problems, maybe more than those. And also something to point out, this is not unique to the city of Alameda. It's like, I think when we look at these numbers across any regions, we tend to see like renters have more of these housing problems than homeowners. Yeah, thank you. So I know we may have covered a lot of information here, and sorry, I know we probably went by quick. Maybe didn't give you a lot of time to process this, but again, these slides are going to be shared later. But we want to hear from you on the chat box. We have two questions for you. We'd like to please type a response in the chat box. So the first question is, if there was something, anything that surprised you from the data that we shared, please let us know what it was. So we can go ahead and type those responses in the chat box. We'll give people maybe about a minute to respond and mention anything that surprised you about the data we presented. or maybe let us know if nothing surprised you. Okay, we're seeing some responses on increased median age of initial access to homeless services. Yeah, I would say, I mean, that's also like the weight increase, I think also surprised us. But again, this is something we're seeing in many other communities. Some people are not really surprised. I see some people surprised by how many people had disabling conditions. Oh, thanks for mentioning no information on gender. We do have, so we actually have a lot of data here that we actually didn't present because we wanted to make sure we just focus on some key findings, but we do have data on gender. So thanks for mentioning that. Okay, I see some people were surprised by age demographics. And so, sorry, surprised about how many people are homeless in Alameda. And where, yeah. So this one we didn't include exact information on exactly where they were, but yeah. Okay. Percentage of substance abuse, an increase of senior homelessness. Yeah, thank you. Work with homeless, many people work with Latinos, so I think we need to fix that in the data. Yeah, thanks. We actually have some data on the Latinx and Hispanic population, so we are included that in the report we have, but we'll make sure we mention that. Yeah. Data question. Oh, okay. And yeah, the other question we have is what other data questions you would like to see answered in the plan. And I think some people already touched on this. Some people already responded to this. So feel free to let us know what other questions you would like to see answered, or what other data you would like to see. And I mean, obviously, we're somewhat limited to the data we have available, but we can definitely try to look for that data. Also, one thing I did want to mention that I think I mentioned at the beginning, like one issue is like a lot of the data they're working with is administered at the county level, so the data available at the city level is also somewhat limited. I see a question. Can you guess the PIT numbers for 2021? I don't know if anybody wants to take a guess. What percentage of folks use daily service providers in Alameda? Yeah, so we do have some data on people accessing services, but it's a little bit tricky. I couldn't get into the whole detail about the different data sets that we looked at. The short answer is it's complicated in terms of different data sets we're working with because it's in a way it's looking at different populations, but we can definitely look into it. Are there organizations that are addressing these issues there are definitely organizations, I think, Erin mentioned a little bit of that, and I think Amanda's also going to talk a little bit about that, and we're also incorporating some of that in the report. So I see a lot of good questions and comments. So I see one, how can we compare with other cities? If they do well, we get overflow from other cities or vice versa. That's a good question. I think that might merit a whole conversation, discussion. Yeah, I don't know if any you want to take over, Amanda, or
Yeah, Miguel, thank you so much for giving us that overview of the data. And as Miguel was saying, there's a lot more to unpack. So hearing the questions that you all are putting into the chat is going to help us to make sure that we capture everything in the full homelessness strategic plan that we're working on right now. So it's really helpful to see these questions coming in. Before we shift to the next part of our agenda, where we'll start to talk about some of those process points and the emerging goals and strategies, I wanted to hand things over to Amanda to talk in response to some of the questions we were seeing in the chat throughout the first part of the presentation and get some of your questions answered. So I'll hand things over to Amanda.
Thank you, Amanda. Yeah, so we saw some of the questions start to come in, and don't have answers on all of the questions this evening, but we did want to pause and take a minute just to respond to some of your questions. So we had some folks wondering kind of what programs are active in Alameda working on homelessness and in what ways. There's actually a large number of programs at work in Alameda, offering everything from housing to food to services to shower programs. I'm going to put a link in the chat in a little bit to a city webpage that kind of shows city programs, but I would also want to be clear that there are also a number of nonprofits and faith-based organizations who are providing services, and especially on the housing front, who are actually providing housing for our unhoused population. There were also quite a few people who are kind of asking, why are we seeing more unhoused people now? And what are the regional causes of this? So I think Aram had mentioned previously that homelessness really is something we look at in a regional perspective, and many of the causes of it are regional as well. So things like the cost of housing, a lack of affordable housing at a regional level. We did a couple months back, we did a webinar where we had someone from Alameda County come in to talk a little bit about this question and kind of what are the causes of homelessness at a broader level. So I'm also going to put a link to that webinar in the chat, because I think that might be helpful for some folks. And there also is a plan that the county has done that I will share that includes a lot of information on that. We also had some people asking about where is funding for homeless services coming from. We actually receive the majority of funding from comes down through the state in a series of grants that we received, but the city also is starting to add funding as well. One of the goals of this plan is going to be to identify and prioritize next steps. And that will include kind of considering what the price tags for some of these programs would be. And then I see what time for one more question. I see someone asking, what can we do first, and what should we do first? And I think that is actually one of the key questions that this plan seeks to answer. So as our consultant team is working on this plan, they're going to be helping us to prioritize what are kind of the most important things that we need to be looking at in the city of Alameda. So with that, I see Lois here. Lois, is there anything you would want to add, or any questions you wanted to answer?
No, I thought maybe you would call on me for some of them, but you did answer most of the questions, so thank you.
All right, so I will pass it back to Amanda Wehrman.
All right, thank you. Yeah, and feel free to keep those questions coming in the chat. We'll do another pause a little bit later before we wrap up tonight to answer any other questions coming in as well. So now that we've heard that foundational information about the data that we have available in the community, what we understand about homelessness in the city of Alameda, as well as the best practices and key terms that we use when we talk about homelessness, we want to get into some of the specifics around the city's strategic planning process. So first off, we just wanted to orient everybody to the guiding principles that we're using to help drive how we're doing the strategic planning. And this includes things like developing measurable goals and strategies. It's really important that we have a plan that we're going to be able to track progress on over time. And so that's how we're thinking about this from the ground up. It's also a guiding principle to address equity as an integral part of the plan. And so that's why you see us looking at things like disparities by racial demographic breakdowns and things like that. So equity is a really important part of how we're approaching this. We also want to engage and empower the community to be a part of the solution. And so that's why we've been having all of the community meetings and webinars like tonight to really ensure that we've got community members as a part of this planning process and the implementation of it that'll come. We're also working to develop a shared vision between departments and within the city, across the city, as well as engaging cross-system partners in how we address homelessness. And most critically, we are being sure to integrate the perspective of people with lived experience of homelessness into every step of the process. And I'll talk a little bit more about what that looks like in practice. I also just wanted to highlight some of the activities we've been engaging in to date since we launched the strategic planning process at the beginning of the year. We've had a number of meetings with community residents and business leaders, focus groups with city staff, nonprofit leaders, focus groups with people with lived experience of homelessness. We have a steering committee of experts in the community who are helping guide the strategic planning efforts underway. And we've done a number of targeted stakeholder interviews. We've also, thank you to all of you who participated in our community-based survey. We collected over 1,000 responses from community members on issues related to homelessness. And we also gave presentations to City Council and the Social Services Human Relation Board on the emerging goals and strategies of the plan. So that's some of the efforts that have been underway, and we're excited to continue working with the community as we refine the goals and strategies, which is what I'm going to talk about next. So now that we've discussed our process, we just wanted to share at a high level those goals and strategies that have emerged so far from the strategic planning process. And I want to know off the bat that these are still a work in progress, and we should expect changes as we collect additional input, including the feedback that we hear from all of you tonight. The 3 goals that we're going to talk about tonight are each supported by strategies and action steps. So we kind of go from big to small in terms of the level of detail. On the screen in front of you, you see the 3 emerging goals listed, and I'm going to spend some time talking about what each of those mean in step. But I'm actually going to take them in reverse order, starting with housing, so that we can end our night talking about mobilizing the citywide response and how all of you can be a part of what comes next. So goal 3 is to secure a housing future for all Alamedans. And we've got 3 strategies here. Strategy 3.1 is to assess and utilize available public and private land for housing. This involves identifying the private and public land that's available for acquisition, rehabilitation, and new construction of permanent housing, including best practices like accessory dwelling units. While Alameda's had huge success in responding to COVID through the Project Roomkey funded Marina Village Inn project, getting 75 high-risk individuals into non-congregate shelter, we know that we still need more permanent housing solutions to fully meet the need of people who are unsheltered in the city. Strategy 3.2 is to protect and expand affordable housing through local policy. And the aim here is to look at displacement and think about prioritizing housing for Alamedans where possible, and to assess the impact of other local policies. Strategy 3.3 is to coordinate short and long-term housing solutions within the county and neighboring cities. And this is going to involve partnering with neighboring cities in the county to secure sites for short and long-term housing solutions. It's also an opportunity to expand alignment with the housing first principles that Aaron was talking about, which we know are proven to work in local programs like Alameda Point Collaborative, which has helped over 90% of program participants to maintain their permanent housing. But as the data told us earlier, we still have gaps in permanent housing with over 100 people who are unsheltered. So next, I want to move on to goal 2. So goal 2 is to increase access to homeless emergency response services. And we've got a few strategies under this one as well. Strategy 2.1 is to develop flexible resources for diversion, prevention, and housing retention, some of those best practices we talked about earlier. So this emphasizes the targeting of funding to help resolve a housing crisis before someone's evicted or in need of shelter. And it also explores ways to use existing and new resources to prevent homelessness for families and seniors, including things like expanding programs we know are working locally, like employment programs. Strategy 2.2 is to provide low barrier housing focused temporary housing. We found the need to establish a 24/7 year-round shelter option, which would be low barrier to entry and align with evidence-based practices that we talked about earlier. Action steps under the strategy include assessing the need for non-congregate shelter facilities and navigation centers, and implementing best practices like accommodations for hoarding. Strategy 2.3 is to expand outreach and supportive services to unsheltered households. This includes clarifying roles and methods for tracking and serving the unhoused community, and a response to the need for increased hygiene and shower services. Village of Love is a great community example of these services. They launched a safe parking program during the pandemic, and they offer a number of things like a day center that connects people to housing and rental assistance and case management services to help achieve self-sufficiency. So with that, we're going to pause for a second so that we can put up a poll. And so you should see a pop-up window come up on your screen. We're hoping that everybody can respond to the poll. We're asking, what do you want to learn more about in terms of homelessness and services in Alameda? So we just went through some goals and strategies related to housing and related to emergency services. And so we just wanted to take a pause and see, what do you want to learn more about in terms of some of those services? And we've got some responses coming in. We're going to give people a little bit more time, see if we can get a good high response rate. So we'll give people time there. And also just appreciate, continue to put those questions in the chat, and we'll be sure to answer as many as we can this evening as well. Okay, I think we've got a pretty good rate of response on the poll, so why don't we go ahead and close that out and show it? Okay, so you can see here that folks are really excited to see some data on the performance of programs, so that's really helpful to know. Learning more about city programs, which we can also definitely do, as well as the programs run by nonprofits and the regional structure for the homelessness move care. So we can definitely make sure to unpack a little bit more of that. That's really helpful to know. And I saw that Amanda also put some links in the chat to other resources that provide some additional context there as well. All right, so I'm going to go ahead and keep moving forward and talk about our last goal in the emerging goals and strategies we wanted to cover this evening. Goal 1 is to mobilize the citywide response to homelessness. And this is where all of us have to come together to really implement all of the ideas in this plan. Strategy 1.1 is to educate and engage the community on the regional crisis of homelessness. We found through some of our early community engagement efforts that you all are really eager to learn more about what's going on, what's being done, how you can get involved. And so that's why we've been offering community meetings and webinars and starting the work before the plan's even completed, including the meeting that we're having tonight. And in a moment, we're going to ask you some more questions about how you'd like to continue to engage and get your feedback on what should be included in this strategy. Strategy 2.2 is to strengthen the homelessness response system infrastructure. So this is focusing on centralizing local efforts, ensuring that everybody's participating in data collection, using that data to help measure success, and other actions that can help support the community's response to ending homelessness. But as we acknowledged earlier, this is also a regional response to homelessness across Alameda County. So it's important to have folks at the county level, the city level, and local community stakeholders all aligning our efforts to prevent and end homelessness. And strategy 1.3 is to ensure ongoing supportive services funding. We know that none of this works unless there's supportive services while people are on the street, in shelter, and in housing. Best practices like trauma-informed care, which acknowledge the inherent trauma of homelessness, help people to achieve housing stability over time. And some local examples of success on the services front include things like Feed Alameda, which offers 105 meals per week to people experiencing homelessness, and Dine and Connect, which is entirely run by volunteers and serves over 350 meals per month across 5 sites. But there's still a huge gap in the meals available over the course of the week, and that just scratches the surface of the types of services that we need. So with that, I'm going to go ahead and pause for another poll. So there's going to be 2 questions that pop up on your screen that we want to get some feedback on. So one is, how could you personally be part of the solution to prevent and end homelessness in Alameda? And the other is, in what settings would it be best for you to learn, volunteer, and contribute? So we're really looking for some feedback on some of those ways that you'd like to engage and be part of the solution, and how you'd like to do so. So give folks a chance to answer those questions. I think we're going to do the polling questions one at a time, so we can just focus on one, and then we'll get to the other. All right, seeing some responses coming in. Give people another couple seconds to respond. And if you have other ideas that you don't see here, you're welcome to add those in the chat as well. All right, I think we're ready to show the poll results here. All right, so folks are really excited about the idea of volunteering at a program. I think we put some information in the chat with the link to volunteer opportunities. So anyone who ranked that one, definitely be sure to check that out. Also saw some interest in donating clothes or food or household items, which is a great way to get involved. I'm really excited to see the number of folks who responded with advocacy in local, state, or federal settings, as well as a number of other responses around donations of time or other resources. So thank you for sharing some of those ideas together. We're going to go ahead and launch our second poll, which is asking, in what settings would it best be for you to learn, volunteer, and contribute? So we'll get that launched. We're interested in the ways that you'd like to be involved, especially taking into account right now the context of the ongoing pandemic and limitations on people's availability and things like that. What ways do you want to continue to learn or be a part of what comes next? So we'll give people some time. Seeing some responses coming in, but we're going to give people a little bit more time to get those responses in. All right, I think we are ready to take a look at those results together. So folks, like the webinar format, you all were here tonight and you'd like to see more of these. That's really helpful feedback. And we'll also do another feedback poll at the end just to make sure that formats like this are meeting your needs. It looks like folks are also interested in some in-person ways of participating with program staff and with participants in programs, which is fantastic. as well as some of our email updates or website resources. In a little bit, we'll put in the chat again a link to how to sign up for the email list so that you can stay up to date on the efforts underway with the strategic planning process. Also seeing a lot of interest in open houses to visit programs, which is a great idea and something that can certainly be explored as a part of a community engagement effort. So thank you so much for participating in some of those polls. Really appreciate all of the feedback that's been coming in on the chat. And I think I'd like to see if Amanda Gerke, if you had other questions that you were hoping to address before we close out tonight. Great, I'll hand things over to Amanda.
Absolutely. We have a little more time left. We should use it. And we've got some really great questions. I just want to take a second to thank everyone who's attended and are putting so many thoughtful and thought-provoking questions in the chat box. We had a question about, who will be replacing Anna Bagtus at the city. So I just want to take a moment to acknowledge that Anna Bagtus, who has been the face of homeless services in the city of Alameda, has transitioned to another role in Contra Costa County. But fear not, she is actually remaining on the steering committee for this project. So she will continue to have a role in this planning process. And we all miss her dearly and are currently looking for her replacement. So we have not identified the person who will be replacing her yet. But I know we are looking really hard and trying to make sure we find the best person for that job. I see a question here about how do we see the results of what has been put in place? And I think that's a great question and something we've talked about a lot as we've been working on this plan. As you might have seen in the data section, right now we don't have kind of one good source of data for understanding homelessness in Alameda, and that's been a real challenge in trying to put this plan together. But one of the things that we are putting into the plan is a strategy where we will actually start to collect that data. So we won't, hopefully in the future, be needing to use kind of this piecemeal approach as it pertains to the data. So a question about whether the city will be participating in the next round of Project Room Key, and I'm going to turn that one over to Lois.
So yes, we're looking at participating in Project Room Key. We have looked at different partners that we can partner with, but officially we need to go to the city council and get direction on that. And I hope to get some direction on this coming Tuesday when I go to city council and speak with them about funds that we're expecting will come in from the county. So that may come up as one of the topics. Thank you.
Thank you, Lois. I'm just looking through trying to pick through the questions here.
I saw one.
Oh, please go for it.
Someone asked about who is the Village of Love. The Village of Love is a nonprofit that is operating the day center and also operating the safe parking at Alameda Point. And so they provide services. They go around downtown and the Webster Street area, as well as other areas of the city, to try to recruit people to come to visit the day center or to park at the parking there that is available. If you register, you can stay there and park your car. You do have to agree to, some of the terms. You have to make sure that you comply with their rules and regulations when you park there. There was another question about encampments, specifically about the one over on Main Street and what are we doing improve that encampment or to get rid of that encampment, and what we're doing about encampments in general. So we do have some rules that we have to comply with regards to encampments. We can't just tear them down or tell people to go. What we do though is we try to provide them with services. We have caseworkers that know the names of the people that are out there, and we try to encourage them to seek shelter. We try to help them to find shelter. As far as having the encampments cleaned up, we do clean up encampments from time to time after we've provided notices, after we've provided shelter for people that are in those encampments. Recently, you may be aware of the one at the Veterans Memorial Center. I believe that's on Walnut and Santa Clara. We recently did a cleanup there. Next week, we're planning to do a cleanup at Main Street. And we are working on some other areas. There was a tent out near Otis Street that also we worked to not remove that, but it did disappear as a result of some work. So that's a little bit about encampments.
I see a question here about what, let me pull up this question again. I see a question here about how folks can direct homeless people they see to find homeless services. And I want to share, and I can put this in the chat, the City of Alameda has a homelessness hotline that folks can call in order to find out about services, find out about any of the programs, initiatives that the city or county run. That line is only open Monday through Friday, 9 to 5, but on weekends, you can also access County 211. So I'm gonna, oh, it looks like Aram has already put that in the chat. And then we also had a kind of general question about how do we help move unhoused folks off the streets and into housing. I can say a little bit about how we do that in the city of Alameda. Is we have outreach teams who go out and try to make contact with our unhoused residents, try to talk to them and understand what their story is, what they need in order to be able to access housing, and then to add them into when Aram was talking about the front door, the coordinated entry system, to start to get them into onto the list and moved towards housing. And there's also, someone had also asked a question about whether we keep a by name list in the city, which is, that's kind of a general list of unhoused folks in our communities, so that we can kind of really understand at the individual level who is unhoused. And we do keep a list like that. And in fact, there's a team of folks at the city who meet regularly to really kind of talk in depth about specific cases and kind of just work at a very granular level to try and house folks. And I saw also that, and Lois, is there anything you would want to add to that?
No, I was just going to say that the by name list is confidential information. That's all.
And I saw that we actually have the city Alameda Police Department's homeless liaison officer is here, and he said that he would be happy to also talk a little bit about the Main Street encampment. So I'm wondering if we can pull him up to be a panelist. Here he is. So we're joined by Officer Pete Larson.
Am I here? Can you?
Hi, Pete.
Thank you very much for having me. So I've actually been out at Main Street the last 3 days, hitting it pretty hard in terms of just doing outreach And it was very interesting to me because most of the people out there I have met, and some of them I had never met. All of them were actually very ecstatic to just have the interaction with the police department, which was a positive one. I'm not patting myself on the back. I'm just telling you what they told me, that they were happy to receive some information about services that have become available via 211 and some of the other programs that are going on, like Village of Love and Building Futures. And so I did actually do almost like pretty much a point in time count out there, and I don't have all of the metrics broken down yet. Everyone's story out there is a little bit different, and not what you might put in a box as a stereotypical homeless person, which you might see pictures of on the news. Everyone's story is a little bit different, and a lot of them have very attainable goals to overcoming their current situation. And so I can also tell you that we have a new police chief, and he has been out there twice with me this week. He's very interested in finding out what the police department can do as we continue to partner with other departments in the city towards helping some of our less fortunate residents. And I also met with the city manager came out with the police chief today. And he's only been on the job for 3 days. So I got to tip my hat to our new chief. And so they're all actively engaged, and we do have a cleanup planned for Main Street. The people that are out there are aware of this, and they know like how to arrange their things to be picked up, which they also appreciate. I don't know if that covers off on everything, but we are making progress out there.
Thank you.
Thank you so much, Officer Larson. Amanda or Lois, do you have other questions that you wanted to address from the chat before we shift into our closing remarks for the evening?
Well, just a couple more that I saw. There's one here that I don't know the answer to, but I'm wondering if you all might, or if Lois does, which is a question about the current waiting list for housing in Alameda County. Do we have information on that?
No, I don't, but we can provide information as a follow-up when you send this information out.
Thank you. And then there was also a question, someone was asking whether the team in the city that works on addressing these issues at the individual level is volunteer or social workers. And I just, that group is made up of city staff and of social service professionals with representatives from the different shelters in the city and different social service agencies. Lois, would you want to add to that?
No, I think you covered it. We have social service professionals from different agencies primarily working on this. At one point, we had someone with social services background, and we're looking to hire Anna's replacement.
So I see someone is asking, does Alameda have available housing for the unhoused population in our city at this time, or is it just temporary shelters?
So we don't have available housing at this time, but we do work to house the unhoused. We identify locations primarily in Alameda County, and we sometimes assist with them to be able to get into the housing units or rooms, whatever they may be.
Thank you, Lois. So there is, and I want to do a time check. I think we may have to make this the last question. What does a homeless cleanup plan constitute? Can you talk more about this? And do people have to leave the area? What happens to their stuff? This may be a question for Officer Larson, if he is still a panelist.
I don't think he's still on, but so people put their trash in bags, identifiable identifiable bags. Officer Larson, I know that you're here now, so did you want to pick up?
You're doing great.
Okay, and prior to us doing a pickup, what we do is we give them notices to say we're going to be here at a certain time, certain place. You need to put your stuff away, or you need to have it so that it's identified so we won't pick it up. What looks like trash to one person may be precious to another. So we make sure that people identify their belongings and put them away. We give them bags, certain color bags to put their trash in so that we pick up those trash bags. And then they need to leave the area when we're doing cleanup. And we pick up what we call trash, or the things that they no longer want.
The one thing I will also just mention is to kind of demystify some possible public perception when they see public works out there cleaning up some of this stuff, is we're not stealing people's property. We're not forcing them to leave stuff behind, or this is a choice that they have made, whoever it is, to discard of property, and the city's not in the business of dumping people's personal property.
Appreciate that. Okay, I think that that was probably the last question we have time for before we shift to closing out. So I just want to thank everybody who entered questions into the chat and your comments, and just ensure folks that we're going to continue to take all of your feedback and make sure that we're addressing these things as we continue to build out the strategic plan. Two wrap up items. We're going to put one last poll on the screen so that you can give us some feedback about how tonight's session went. We'd like to know about whether the information that you heard tonight increased your understanding of the issues and the solutions regarding homelessness in Alameda. And we'd also like to know if you would attend presentations, discussions, or volunteer days related to homelessness in Alameda on a regular basis. So we're going to get that poll up on the screen. While we're doing that, I think I'll hand things over to Amanda Gerke, who's going to talk a little bit about some next steps and contact info and other ways that you can continue to stay in the loop.
Thank you, Amanda. And thank you to Amanda and Aram and Miguel for their fantastic presentation tonight, and to Officer Larson for stepping in and helping us answer some of these questions. In terms of next steps, our consultant team is working on drafting the report over the coming weeks. So they're going to be incorporating some of the feedback they've gotten tonight into the report. We're planning to bring it to the Social Services and Human Relations Board this summer, and then to City Council in September. So if you are interested in attending any of those meetings, providing further feedback, reviewing the draft report, please sign up if you haven't already for our mailing list. And I'm hoping Aram can maybe drop that mailing list sign up in the chat one more time, so that folks can sign up if they haven't already. It really is the best way to stay informed about the progress of the plan. I also want to invite folks, if you have things that occur to you after this, or if there's something you didn't get a chance to say tonight that you really want us to know and that you want to bring up, I invite you to email me. My email address is on the slide here. You can also email our consultant, Homebase, at the email address on the screen. We're really, as Amanda said, greatly appreciate your attendance tonight, your time, your thoughtfulness, your questions, and just the general enthusiasm that we're seeing about being a part of the solution. So thank you all very much, and I hope you have a great evening.